Let's begin. I'd like to welcome you to our first interprofessional education event on the theme of scleroderma. We're very happy to have you here. My name is Barbara Thompson. I'm a professor in the Department of Occupational Therapy here at the Sage Colleges, and I'd like to welcome everyone. And I want to give a special thank you to somebody who was very much part of organizing this event. Noelle Nichols, could you please stand up? I want to give Noelle works in the dean's office, and this event would not have happened without her. She's put in a lot of time and effort to take care of all the details that need to happen, and I thank you very much, Noelle. Thanks, too, to the faculty who are here and all of you. I know it's a long day for many of you. It's an important event. And I'd also like to thank the members of the Scleroderma Foundation. They'll be introduced in just a moment. And most of all, I want to thank the patients and family members who have traveled here to Troy this evening, braved the cold weather and the parking problems in Troy. I really appreciate your coming out. So you'll be meeting patient and family members a little bit later in the evening. So let me just briefly explain what's going to happen. There are programs on the table. We have a pretty tight timeline, and we're going to be queuing you on time throughout the evening so that we stay on track. Basically, we're going to hear a keynote speaker in a few moments. Then you are going to work together with your fellow students to come up with an initial interview, as if you were interviewing an individual who has a diagnosis of scleroderma for the first time. You will have 25 minutes to do that, and you will have to figure out how that is done and what questions you want to include on that initial interview protocol. Heather Franz will say a few moments, make a few remarks about what constitutes a good question, and then you're on your own. There will be a first-year OT student there who will be taking down the questions. The questions will then go via Google Doc to the panelists. They will review the questions and comment on the questions and say, that's a really good question. Might reframe this question in this way. You missed this area. Think about X, Y, and Z, just to give you some initial feedback. You'll have another 10 minutes to revise your interview. That will be recorded on a separate document, Google Doc. And then we will be joined by 20 people who are living with scleroderma, and there'll be one person per table, and you will conduct the interview, and you will have 20 minutes to conduct the interview as a group. You will need to figure out who leads it, how you lead it, does everybody speak? That's your call. And then the last 10 minutes, the person at the table who has been kind enough to share their story with you will give you feedback on your questions and what the interview was like for them. Then you will have a few more minutes to come up with your final interview based on the feedback you received from the patient and submit that, and then we're going to have some closing remarks and an interview with someone conducted for you, so modeled for you after you've had a chance to do it yourself. So it's a full program, and without further ado, I'd like to introduce Peter Menon, who is a board member with the Scleroderma Research Foundation, and he would like to further welcome you to this event and say a little bit about the foundation.
As Barbara mentioned, I'm a member of the board of directors of the Steffens Scleroderma Foundation. I'm also joined here tonight by my wife, Linda, somewhere in black. She's the more dynamic part of the duo, and she's vice president of the Steffens Foundation as well. I wanted to just mention three major goals of our foundation. First is to perform research towards the treatment and cure of scleroderma, Dagos, and other related disorders. The second goal is to promote understanding and awareness of scleroderma, particularly among healthcare professionals. I want to really emphasize that point. That's why we're here tonight. And the third goal is to promote collaboration, particularly nationally and internationally, towards achievement of all those goals. I want to mention, I think this is very, very important, that we want to support and encourage interprofessional education and the necessity for cross-disciplinary teams, both in research and in the treatment of scleroderma patients. I was a former manager of research at GE's Global Research Center, just locally here in Niskayuna, and I can absolutely testify, and I can't overemphasize the importance of cross-disciplinary teams towards the treatment of patients and also in research. I can't overemphasize that enough. I also want to mention, as Barbara did, that we're filming here tonight. The reason being that we want to share this as a best practice among other scleroderma organizations. One final note is that part of our organization is something called the Friends of Steffens. A friend of Steffens is a person or an organization who wants to help us and assist us in promoting either a cure or treatment of scleroderma. Now, as students, okay, you could be doing simply emailing, getting an email for a newsletter about scleroderma, or you may even have the interest to participate in the investigation of some aspect of scleroderma and produce a research paper, a report that may be part of your learning experience. Now, I also want to thank, now when you thank people, you always have to be very careful that you don't omit anyone. So I want to thank, I'm going to have to use the chip sheet here, and I want to thank the following people. I'm old, so I have to get my nearsighted glasses here. I want to thank Barbara Thompson of the Sage College's Health Sciences. I want to thank Gina Gerlach of Sage Student Occupational Therapy Association. I want to thank Bobby Lukasiewicz of the Steffens Scleroderma Center, the Albany Medical College, the Albany School of Pharmacy and Health Sciences, all the experts on our panel, keynote speaker, Amy Geitzen, and all the patients and students who are participating in this event tonight. We truly, truly thank you for participating.
Hi, my name is Amy Geitzen, and I am the keynote speaker portion of this evening.
Hi, my name is Michelle Morgan. I'm a registered dietitian and faculty here at the Sage Colleges.
I'm Celeste Freeman. I'm an occupational therapist and a certified hand therapist. I work at Albany Memorial Hand Center and teach as an adjunct here at Sage.
I'm Lee Shapiro, and I run the Steffens Scleroderma Clinic down in Albany and in Saratoga.
Good evening, I'm Heather Friends, and I am the Director of Simulated Patient Education at Albany Medical College.
Hi, I'm John Rice. I'm a social worker with Albany Health Management Associates.
My name is Amy, and I was asked by Bobby to do the keynote speaking, and I just want to thank the Steffens Foundation and everybody for giving me a chance to, and this great opportunity to come and talk to you guys more about scleroderma. And with that, I'm just going to share a little bit of my story and what scleroderma is to me and how great it is, I think, that what you guys are doing with this team effort for interprofessionals. So, scleroderma is a rare chronic autoimmune disease that has been found mainly in women between the ages of 30 and 50. It has also been found in men, teenagers, and small children. There are currently around 250,000 patients diagnosed with scleroderma in the United States. Scleroderma is a disease that has no known cause and, as of right now, no cure. Scleroderma can affect the skin, muscles, joints, blood vessels, and major organs like the heart, lungs, esophagus, and kidneys. Scleroderma causes your skin to become hard, thick, and tight. It can also harden, thicken, and tighten your major organs inside your body, which can lead to a slew of difficult, complicated, and dangerous medical problems and even death. If you look into a large crowd, only 1 out of 1,000 people have scleroderma. I am that one person in this crowd. I was diagnosed with scleroderma a month after I turned 19 years old. I was a freshman in college, like some of you guys, studying to become a registered nurse. I was working a full-time job as a dietary supervisor at a local nursing home in Buffalo. I was just like every other 19-year-old my age, just trying to live my life and become a contributing adult in society while going out partying, drinking, and trying to get good grades. Just trying to live my life. The day I was told I had scleroderma, that all completely changed. My life completely changed. Knowing what I know now, I was lucky to have been diagnosed when I was with scleroderma. I went to an orthopedic surgeon thinking I needed shoulder surgery and came out diagnosed with a disease I could barely pronounce, let alone spell. I had never, ever heard of the word scleroderma before that day, but I would hear it every day from that day on for the rest of my life. It took some time for the shock of my diagnosis to wear off, but when I did, I knew the only way I was going to be able to live a productive, semi-normal life was to find out as much as I could about this disease and what it had in store for my future. So from the research I had gathered, which in 2001 was not a lot at all, I knew I needed treatment from professionals. In this particular situation, finding a general physician was just not going to cut it. I needed several different kinds of specialty doctors that could treat my body and the various parts of it that were being affected by scleroderma. Over the years, I would need over a dozen specialty physicians to treat all of my medical issues brought on by scleroderma. And going from doctor's office to doctor's office 3 to 4 times weekly was very taxing on me. I also had to cart with me all of my medical records, any new tests, reports, blood works, films, anything new that I had done that were ordered by my other doctors, because having a dozen doctors communicate regularly and be on the same page was not an easy feat when you're traveling from different location to different location. Reports would go missing, test results would not be sent to the correct doctor they were supposed to be. I began to see my health taking a backseat to all of the miscommunications and mishaps that were taking place due to all of my doctors not being a team, not working together, not being on the same page, and not willing to put their differences aside to treat their patients. I had to find a problem to this solution. In 2005, 4 years after my initial diagnosis, I came across a scleroderma specialist in Pittsburgh who had been researching and treating patients with scleroderma from all over the country for over 41 years. He was practicing at not just an office, not just a regular doctor's office, but a center, a scleroderma medical center. It was for the medical treatment of scleroderma in entirety, from top to bottom of the disease. I called his assistant and made a consultation for 3 months' time. To my surprise, this consultation was not just with the rheumatologist that I had found online, but with a pulmonologist, a cardiologist, a GI doctor, along with several other doctors. And then there was tests that I had to have done. I ended up having a 3-day-long schedule, seeing social worker, nutritionist appointments, blood work, cardiac tests, blood tests, x-rays, pulmonary tests, social worker consultations, urinary analysis, several esophageal and swallowing tests, and that was just day 1. I was overwhelmed but pleasantly surprised at the organization and the thoughtfulness of the doctors and the thoroughness of all the medical staff there, and with what ease that they worked together. I was excited to see how this scleroderma center was going to handle my disease and all of the baggage that came along with it. My first impression of the medical center in Pittsburgh could be summed up in one word: impressive. From the minute I stepped through the hospital-wide double doors at the main entrance, I knew this was a place I needed to be for treatment. Besides the fact that every person I came in contact with was kind and pleasant, Overall, I have to say 99% of the people working there knew what scleroderma was, how it presented, signs and symptoms, ways to treat the disease. And I'm talking even the secretaries knew, and especially how to spell it. I felt like I had really found my people. I felt like I had found my place. The Scleroderma Center in Pittsburgh was like a breath of fresh air. Everyone was so well versed in scleroderma and the treatment options. Each doctor I saw had quite a bit of educational information on how scleroderma affects the body and each part of the body and various ways of treatment. For me, just one visit was enough to keep me coming back for treatment for the last 12 years. The center has helped me to maintain a healthy lifestyle while still being quite an unhealthy person. Personally, I have had treatment from individual doctors at individual hospitals, but I have also had treatment from doctors that work together as a unified team. And I 1000% feel that the team effort is much more effective, efficient, and beneficial to the patient. Having a team of professionals in the same place with access to your entire medical records at the same time is something that is a must when treating scleroderma. Not every symptom that a patient experiences is the same. Patients present the symptoms in different ways. No two patients are the same, no two symptoms are the same. This can make for very difficult and frustrating treatment. It can be frustrating for the patients and their caregivers, but also for the doctors. I lost my spot, hang on. Having access to the entire medical team at every appointment allows me to address every symptom or issue I'm having at the same time, not holding out for each individual doctor's appointment to find out which part of the body may be affected and why. Yes, there are setbacks, as with any disease, but anytime I'm having a flare-up or a particular awful symptom, I can get treatment from that firsthand that saves time and allows me to start treatment right then and there instead of having to see numerous doctors at numerous places in a month or 2 months' time to iron out all my problematic issues. Scleroderma has taken a toll on mostly every aspect of my life and my body. It has made living much more challenging and has caused me to have to reevaluate certain components of my life and my health. Nowadays, when a problem arises in my life, whether it's physically, mentally, economically, or socially, I look for the most efficient and effective solution to that problem. I would much rather spend what little time I may have left here enjoying the beauty that is living. Having a team of medical professionals at the same place to treat me accordingly and work together seems like the best course of action for my life and lets me have all my extra time enjoying doing the things I love. That to me makes sense. As a 36-year-old woman living in today's society with a chronic illness that is scleroderma, my medical professionals are like my second home. They see me at my best and they've definitely seen me at my worst. They have listened to my problems and helped me to come up with, here's my last page, with reasonable and effective solutions to those problems. Going to several different doctors on a regular basis has become part of my life. Looking back over the years and remembering the struggles and the challenges, the heartbreaks and the breakthroughs, my life has been filled with all kinds of adversity. So when dealing with my medical care professionals, the last thing I want is to have doctors who are all fighting over control for my medical treatment and who can't work together. Since finding my medical team in Pittsburgh, I have had 0 issues. Everyone is there to look at the bigger picture, which is finding the best possible treatment plan for my body and to keep me as healthy as possible for as long as possible. Looking here at all of you tonight, I am eager to see what new and exciting things this group of intelligent, educated, professional men and women can put into action. I hope all of you can see that working together as one unified team can allow for amazing breakthroughs in patient care and medical advances. Each and every one of you sitting here tonight plays a vital role in the care and treatment of patients with this disease, or with any disease for that matter. By working as one, I know the best is yet to come for the education and medical advances in the treatment and eventually the cure for this rare and detrimental disease that we know to be scleroderma. Thank you.
Thank you so much, Amy, for sharing your story. I was lucky enough to just have a phone conversation with Amy the other day, and it was our first meeting, and I was really, really touched by the way she spoke about her scleroderma and her path. So you are incredibly lucky to have heard that today. I'm Heather Friends. I'm the Director of Simulated Patient Education at Albany Medical College, but that's not how I landed here today. I'm also a scleroderma patient. I'm a patient of Dr. Lee Shapiro's, and when we spoke about this program, I was initially brought in to maybe be one of the patients at the table, and then I said, hey, I kind of know some stuff about interprofessional education and questioning skills. How about I talk about that? But I am a scleroderma patient as well, and I really like the idea of being part of this program as both a patient and a professional. So thank you so much for having me here tonight. You're going to sit down as a group, and this is a fabulous simulated setting where everybody's in the same room, and this is great. So we know it's not typical that you're going to have an OT, a pharmacist, a nutritionist, a psychiatrist, all of those wonderful specialties that you have at your table all in one group. But this is simulation, so you have it today. So learn from one another. Interprofessional education is one of my favorite things that I do as a professional, simulated education professional. So I think you have a great opportunity tonight. Go with it. It's not completely natural, but do your best to try to make it as natural as possible for your patients who are going to provide their time tonight and be there to be interviewed by you. Couple of things to think about, just some broad strokes when it comes to communication and questioning skills. I think it's really important to start out with those open-ended questions. Invite your patient to tell you their story. You miss a great deal of a patient's story by going right into those focused questions, okay? Start with those open-ended questions. Hear them, listen attentively, follow up on what they've told you. Patients will offer you clinical cues if you are listening to their story. So really ask those appropriate follow-up questions. Make sure that you show interest in your patient as a person. Find out how these symptoms are impacting their life. I can tell you that I have Raynaud's, and pretty much every time I'm up presenting in front of people, it's nice and warm in here, so I'm really excited. But I'll be in front of 150 medical students, and I'll realize that they're all looking at my hands because I'll have one white finger. Right? That impacts my life every time I go up to present, and I present constantly. So ask about impact on life. Find out from your patients how this is affecting them. That's really, really important. Then make sure that you are working in a shared decision-making manner. Get your patients' buy-in. Elicit their perspective. Find out if their willingness and ability to accomplish the follow-up plan that you're presenting to them. And then I think what's really key is making sure that you're summarizing all the information. And after you summarize that information, saying, is there anything that I've missed? And then concluding your interview with your patient with some next steps. I think this is a fabulous experience. I wish you all the best as you sit and learn from one another today, and I look forward to being part of your interviews. Thank you.
What you're going to do now, and you'll have until 6:35, which sounds like a lot of time, but within that time, you as a group are going to come up with your initial interview protocol, taking into consideration the suggestions that Heather has just given us. You will also, within that time frame, have collected the questions, ordered them, and sent them via Google Doc. The OT student at the table will take care of that for you to the panel. Then there will be a short break, and the panel will review the questions, get up, walk around during that time, get some water, take a break, and then come back to the table, and then we'll hear from the panel on the questions. It's going to be a lot for them. If you get done ahead of time and work very efficiently, send your Google Doc early, because that will give the panel time to review it. There are a lot of tables, there are 23 tables here tonight. So that's the agenda. We're not going to intervene. You have 35 minutes to develop your interview protocol, upload the questions to Google Doc, and send them to the panel. And faculty are here from various disciplines. We're going to float around, we're going to eavesdrop, but we're not going to intervene. Any questions? It's pretty self-explanatory. You figure out the rest as a team, okay? Begin.
Yeah, it's both and. So you're going to start with this pretend patient.
Okay.
Create a first draft.
Okay.
And then once you've got that ironed out, you're going to get feedback from the panel,
Right.
and then your patient's going to come in on your second go round.
Okay, so we're not going to use the same interview questions.
Well, you
from
will,
first.
but you'll get a chance to tune them up.
Okay. Yeah, okay.
Yeah.
So I guess we can still ask things like,
Right.
you know, when were you diagnosed? We can say, like, what were the first symptoms? Like, what,
Yeah,
that was.
how did you,
What draw you to it?
Yeah, exactly.
What did you initially notice prior to diagnosis that caused you to seek medical attention?
That's a
And then
great
we have,
question.
can you share some of the thoughts you've had after first being diagnosed?
Yeah.
Yeah. The feelings.
Yeah. What if I could just open up the document that I already have?
I know there's a document on here. It says to go to.
Oh, okay.
I don't know. Scleroderma IPE 2018. I don't know.
Oh.
Yeah.
Yeah, that's good to start with.
Definitely. Like how did your family respond to your diagnosis?
Yeah.
Or like, do you feel supported?
Like what she was saying, what areas of your life are affected.
Routines.
Most of the questions I have nutritionally related are like GI issues and things like that, like specific. So
We can put those here. I'll just put them.
I feel like we should do like she said, the,
A lot
like
of
the
open-ended.
open-ended, and then we can say, oh, one of those symptoms was dry mouth, and then go from there. Of how are you handling that or whatever.
Like if the patient says they have. Whatever,
Right.
Then. Exactly.
That's the next question.
Yeah.
About hobbies.
Yeah.
Yeah, like what do you like to do in your free time?
Right.
Yeah.
Has this activity?
Has this impacted your ability to participate in things that are enjoyable to you?
Yeah.
Or if she has to adapt to the way she completes different leisure activities too.
Can we ask like how involved her husband is when he's home?
You can say,
How does your husband help out?
Yeah.
you can say, how has this impacted your independence?
Yeah. Or if she has support at home.
What areas of support, what areas do you need support?
areas of
Yeah.
support like that. I mean, I guess if her children live close,
Do they visit often?
are they helpful?
Yeah, it's nice to just like dive into that a little bit more.
Right. Or
I feel like we could have said that in the beginning.
Right. Real prep for me. Right. And I think a lot of her motivation too will be because she has
A
grandchild on the way. Like she'll want to.
What are some things you are looking forward to?
Take care of. Right. Like be a grandma. I mean, that's. Yeah.
Any,
Plays the guitar.
I was gonna say any therapy. If she's receiving any therapy, what's helping, what's not helping.
Yeah. How much does she know?
Any equipment she's using, any adaptive equipment.
I mean, on our terms, we can ask if she
Energy
has any
conservation.
trouble. I mean, food-wise, because it can cause like GI distress, either with diarrhea, constipation. If she's experiencing any of those.
Yeah, so I would keep it more in a broad sense. Like, do you have any difficulty with
dietary
diet? Yeah.
Have you experienced any dietary difficulties? Examples.
And I want to know, like, what is her diet at home? So, like, what are things that she stays away from?
Yeah.
Because of this. Because it's so hard because everybody has a different reaction to a different type of
could do like a subset just because there is like a
That's what I was going to ask you.
GI
So
problems
some
compromise 90%
be able
of
to take
scleroderma
like gluten,
patients.
for example.
So
Others
like
won't be able to
hardening in your GI system can lead to constipation, things aren't absorbed properly, indigestion, trouble swallowing.
So it's really just
very individual.
Yes, because it just depends. So they have to. They go through like an elimination diet, they call it. So they stop, like, they just do bland, and then they slowly introduce like one food per like 3 days to see how their body reacts to it. So she might already know, or she doesn't know, and should be educated on that.
Yeah, well, I think with all of our professions, I think that it's all going to be based off of the patient and what is best for them. And I mean, we can talk about pain management and energy conservation, but it's still going to be different.
Totally.
For each individual because, it will affect this Amy differently than it will.
Absolutely.
Yeah.
I don't remember her name, but you know what I'm saying.
Yeah. Very individualized. Okay, so we have every day. What do we have so far?
We have asking them about themselves, how it affects their everyday activities. If they have difficulty managing day-to-day tasks, their leisure activities, if they have a support system, if they're receiving therapy, and then if they have any dietary difficulties or restrictions right now.
Yeah. What about like talking about overall quality of life, like type questions?
Could ask about her outlook too, like how she's personally feeling. If she's feeling depressed or she's feeling motivated, and I don't know.
Yeah, like what motivates you, and what's that question? There's a question that it's like a really good one, and I don't remember how it's worded. Like you could say what motivates you. That's
From their standpoint, any
because
issues.
especially like the keynote speaker, she was saying how difficult it was with all the different appointments. If you don't go to that one place in, where was she talking about? Like, that has all the doctors that she needs. It's so difficult. So we could add something about that.
It's true, the information gets lost.
So should I say like the medication and doctors after?
Okay, you've got about 15 more minutes. The panel is already reviewing your questions. Keep revising them. You have about 15 or so more minutes.
Either that or the beginning of like diagnosis and more like medically
Just assessing,
based type stuff.
Are you able to follow your, I don't know how to phrase
I would just say like how was like your medication going? Just kind of like ask generally about it, because we don't know, like maybe she doesn't like the medication she's on, or like something like that. So just kind of like getting a better understanding of what she's on, why she's on it, if she wants to try something different, if it's helping her.
Right.
Do you feel like your medication is helping you?
Yeah.
Or what were you guys thinking?
How did you phrase it? That was good.
Oh my god, I forgot how I said it. I just said that we could ask her how her medication management is going.
Yeah.
Or like how taking her
It's hard
medicine-
without having
I guess like just
pharmacy
like
students, but-
how is taking your medicine going? Is it helping you? Like, are you feeling better from taking it?
So with the when we were talking about the other disease states, we'd also want like a medication list and an adherence. Because if she's not adherent to medication and treatment, then that's going to be a consideration factor that we can take in for new
So what
treatment.
medications are you currently?
I would go with treatment.
I'd say treatment. I wouldn't say like, because it's all kind of like lifestyle medications, herbals.
Yeah, we did. That was number 2. What current treatment are you using?
So that's just for the for this. But so like, what are you asking about other disease states?
Oh, I see what you're saying.
So we also need kind of like
How are you being treated for those other diseases?
and essentially what I'm trying to get at is adherence.
Okay.
Because if she's non-compliant, non-adherent to her current medication, any current medication treatments, that's going to be taken into consideration for any new treatment.
Yeah, like has she joined any support groups, or does she know of any, has she talked to someone else that has,
You can ask if she wanted additional
Treatment of those
as well.
and adherence.
Because maybe she doesn't know that they exist. Yeah.
I mean, that can also be found via calling the pharmacy, seeing what medications is on, what she's been picking up.
Send groups or resources. Yeah.
The community.
That you would benefit from.
Well, I guess so that.
Have you been taking your medications?
Do we know that there's I'm assuming. Yeah, I don't know what they to control the symptoms.
52-year-old.
Did I take your thing?
I was going to have some.
I get out there. I'm like, no, it's okay.
What are you looking for?
I haven't said anything about medicine, but
It doesn't say anything about other disease
She's
states.
so new that. Oh, she was diagnosed though, so she is probably on medication.
I'm Jessica Farrell. I am a pharmacist and associate professor at Albany College of Pharmacy and Health Sciences. I've been working with scleroderma patients at the Center for Rheumatology with Dr. Lee Shapiro for almost 10 years now. So it has, I think, changed me as a clinician, working with such an amazing group of patients. So hopefully I can provide some perspective from the pharmacist's perspective, and how I've worked with managing medications and addressing medication concerns around safety and even logistics of swallowing medications. So are we going to do this first and then back the questions? Okay. So one of the big comments that I have, and one of the things that from my perspective as a pharmacist, so I'll see patients, I don't only see scleroderma patients, but I'll see rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and I see everyone's patients. So I work with almost 18 or 19 different providers, so I'm seeing those patients kind of sporadically. And one of the problems that I have is that, I wasn't in the last visit that they were with their physician. And I can read the office note from the physician's perspective, but I find it extremely helpful to start with, what do you remember from your last visit with Dr. X? So it's very open-ended. It allows the patient to start the conversation and tell me what they remember, which also gives me information about health literacy, their education level, what information they went home and started researching on their own. It also allows me to gauge a level of anxiety that they may have. If they focus on something specifically, it shows that they have motivation and that that's maybe where they want to focus the conversation on. That's where their anxiety lies. So that's generally how I start the conversation. Since I don't always have the opportunity to develop a, every 3 month regular, long-term relationship with the patients, I'm seeing them more sporadically. So that was just one of the things that I noticed from some of the conversations, questions that you guys had all put together. So.
And to piggyback on that, when I would see patients in an outpatient setting, not specific to scleroderma, but it's really important to identify why they are there from their perspective versus saying, oh, you've lost weight, so you're here and we're going to talk about that. So really important to get that perspective from the patient, and a lot of the questions that you have can be answered through that open dialogue and conversation, just listening. And something too that we talked about is there are so many potential things that can be addressed, which can be overwhelming not only for the practitioner but also the patient. So it's really important, again, to make sure you're meeting that individual where they are, and that should help guide the session or the meeting.
So I see folks in an outpatient clinic setting, and typically it's the beginning of a relationship that's sustained for a period of time. I don't see people many times a week, but I do see them for many, many weeks. It's important in my first meeting to give the individual that's sitting with me. Sometimes they've been diagnosed. Dr. Shapiro has sent people to me as early as within 1 month of diagnosis, and sometimes a little bit longer than that. And so I would say the first goal is, regardless of the technical questions that you ask, it is imperative that the person feels safe with you. And that is the beginning of trust. And for those of you I've taught in lab, you fully are aware of the fact that I'm quite right-brained, and so for me to run down a laundry list of exactly the questions, stop that smiling, of how I would ask what question, I just want to make sure I find out what is most important to them. We do have a health questionnaire that they come in with, so that is a good basis for me to go over some of the things and say, I see that this is a problem, or this is a problem, or that this has happened in the past. And that's giving them an invitation to tell their story. So you want to hear the story, however you get it out, and you want to pay attention, and you want to be accurate, and you want to help the person feel safe to disclose anything they want to. So I would say, sometimes asking about a support system at home has to be something they're invited to tell you about. I would be careful about how I would phrase that. Sometimes it's funny. I'll say, "Do you have help at home?" And they say, "Well, I have a husband." And I'm like, "No, wait." So I didn't mean to get into that, but you have to be gentle and yet direct, and you want the person to feel that they have one piece of empowerment when they are finished with you, that first encounter, something that gives them a step to take.
Again, I'm a rheumatologist. Often their introduction to scleroderma, and so one thing I want to emphasize is just how important it is to individualize the approach. People come with all levels of knowledge and pre-knowledge, and I try to find out what that is. Sometimes it's very dark, that they're only, that if you took awareness of scleroderma or just asked 100 people in this community, the largest group have never heard of it. And so you have to kind of be aware of that maybe they've never heard the word. And the second largest group, sadly, is bad stories travel, is that they know of it because a relative or a friend or a relative of a friend died of it. And that may not come out right at the start, but the diagnosis often is attached with an enormous amount of anxiety and fear in addition to whatever symptoms they have. I also find it helpful to know as much as I can about the individual, and sometimes you have to explain why you're asking these questions. So I've gotten people wondering why I'm asking about their pets, but often, I have people, my record holder now I think is a woman with 70 cats, and so it certainly is important in terms of how does she manage that task, and what are the challenges. So you have to kind of picture what the home is that this individual is in, and so you have to, so these questions about support systems, sometimes you can infer that the more you know about this individual and just how many people are in the house and who does what and what has changed. So when you're seeing them, especially if they've dealt with the disease for a while, what that daily routine is may be incredibly different from what it was a few years before when they were playing the guitar and running 5Ks. And so you don't want to just know the individual who is before you with a host of issues, but you also want to know what their starting point was. And the more you know, the more you can help, because the more you can identify, even without specific questioning, what is it that they're missing from their life, and where they want to return to. And I just want to also, we do need, unfortunately, to know something about access to care, because if they're going to have to pay $50 as a copay for each OT visit or PT visit, or to see a dietitian, you have to kind of share that with the other caregivers in terms of trying to, you can't make it a prolonged process. You're going to have to really pack in as much information as you can in a very few sessions. And this happens, unfortunately, a lot. How much care you get, unfortunately, relates to your insurance and your access, and it's sad. I would also, again, the trust issue is a very important one in terms of just not appearing intrusive in your questioning and explaining what your need to know is. You can also have to pace your questions in terms of there can be information overload, there can be question overload, and really pick your target in terms of, again, what you need to know, and try to hone in once you find out what the biggest problems are. Because with this disease, there are often many different organs involved, many different issues, and you really have to address the big ones and make sure you haven't missed the biggest ones. And let me just say that I'm so thrilled actually to be part of this, and because we want to create a community of health providers where the patient doesn't have to be always the one in the room who knows the most about the disease. So the more you know, and they'll sense this right away, that they're talking to someone who's a blank slate, and they have to do all the education. And that's an enormous burden when you're trying to get help. So the more you know, the better. Thank you.
I'm John Rice. I work with an international expert in chronic illness, Patricia Fennell, out of Albany Health Management Associates. And the model that she practices from is a phase model, and people move in. Typically, it's the things in our lives that we could just as well do without, thank you very much, what she calls imposed change. And that when we typically go through imposed change, we go through phases, from a crisis phase to a stabilization phase. Some people return from stabilization into crisis and stabilization into crisis. And with help, we can move into what she calls a resolution phase, which she calls the dark night of the soul. And that's the emotional heavy lifting phase, the meaning phase. How do I deal with suffering? And then again, with support, people can move into what she calls integration, which is living with. And that could be living with a mental illness, it could be living with loss of a limb, it could be living with scleroderma. So a number of the questions that I saw relate to very well with this model, which is to look at the functional. How does the person deal with their dog? How does the person deal with their husband who's away, and what concerns might come up? The physical, that's the functional physical. And there's also the psychological spiritual, which is how does this person experience their illness? And the social, which is, so what about your support system? What relationships do you have? How are those relationships? So I saw a lot of questions along those lines. They're covering all the bases in that way. And the more open-ended, I think, the better. To start with, a simple question of what brings you here would be in a social work interview. One kid that I watched years ago in a session said the bus. Okay. Well, that tells us a little bit about him, right? He's starting off with a strength, which is his humor, and his seriousness. He's probably really did take the bus. So the other piece that I noticed was the importance of using a patient's language or a person's language. They might even say they're a patient, but an individual's language. And I saw the term resilience come up. And that may be a term that is important to the person, or they may not understand that term. So I was an intern, a social work intern at Sunnyview Hospital many years ago, which did physical rehab. And when my supervisor had a question that I found very helpful, which is, like, what keeps you going? Which is that we do have that resilience, we just need to find it. So quick example of that, my father had diabetes and had an amputation. And we came into his nursing home room on the day of their 50th anniversary party. And I said, how did you sleep? He says, bummer, not very well. And he had a stroke, so he wasn't using a lot of sentences. And he said, no, you didn't sleep very well. What was going on? He was up thinking. I said, what were you thinking? Now, my father grew up on a farm. He said, alternatives. I said, what'd you come up with? He said, a horse. That was resilience. That was him still finding a way to move forward. So I take that as an example of what is inside of us, what keeps us going. And even at that juncture, that you still have that sense of moving forward. We're faced with horrible news. The other piece, again, from a social work perspective, I would just commend to maybe take a look at the psychiatric, called the Diagnostic Statistical Manual. The DSM-5 is the manual that people look to for diagnoses around psychological, psychiatric issues. And there's a beautiful interview, set of questions in that book at the end called the Cultural Formulation Interview. And it starts with, so what brings you here? And it gets the person's language about that. And it gets to these other issues of the social piece and how are they coping and what does their environment around them say about this. So there are a lot of pieces to this. The last comment I would make is to think about what is the person's relationship to what they're dealing with? And I think embedded in that question, that mindset is that you are not your disease. You are not this alone. So a person can say, my relationship to this experience is such, I don't like it, or I've embraced it, tells you a lot. And it also embeds in the fact that this person is still a whole person. Thanks.
My name is Amy. I'm not a medical professional. I'm a patient of this disease, and the only thing I can really just kind of wrap up in saying is that as a patient myself living with this disease, it's important for me when I go to any type of medical professional that I feel like I'm heard. So I know with the new technology, there's a lot of typing going on and making sure that, you know, you're charting and getting everything down, everything, dictation of what we say, but it's important that I feel that if my doctor or my medical professional hears me and looks at me and acknowledges my feelings and what my issues or my symptoms or what I'm saying to you, that goes a long way in what they were saying with the trust issue of having somebody that knows the disease and is educated about it and not feeling like you have to educate your doctor. So I think that's a really good perspective, is to maybe do your dictation or do your typing halfway through, or just ask them about their lives in general as opposed to the illness. A doctor, one of my favorite doctors, always says, "What's new in the world of Amy when I see her?" You know, and she's not asking what's new in the world with my disease, but she's asking with me as a person. So it makes me feel like, you know, I'm not just somebody living with scleroderma. There's a lot of other aspects to me as a person, and that my physician cares about those things and not just get out, get your medicine and have a nice day. So I think there really is a trust aspect, because you're coming to see this person. I mean, sometimes I'm at the doctor's office twice a week, 3 times a week, depending on my issue at the moment. So I have to feel like you're on my team, so to speak. So I think that's a good thing to have.
I just want to say one more thing, which is on the subject of resiliency, that I find that yes, we ask questions and we're asked questions, but that often when we have these interactions with someone with the disease, we learn a tremendous amount as far as yes, emotional coping skills, but also how they manage to keep doing tasks that are difficult. And some of the best ideas that I share with others are ones I didn't read, but what someone told me when they walked in the room.
I would have to, there was a little side discussion while you all were working, and we were talking about being willing to be uncomfortable as a professional. And it is my personally strongly held perspective that if you are not willing to be uncomfortable as a professional and learn something or find out that you didn't, I am always feeling like, gosh, there's so much I could do, there's so many areas I could address with the folks that I see. I have such limited time, and they have limited time, and yet I learn from them all the time. I learn from folks that come to see me, they give me great ideas, we feed off of each other's ideas. You have I think I talked at the first planning part of this event, and I said you have this big bag that you carry about as a clinician, and you add to that bag, you always keep adding to that bag, and then you can retrieve out of that full bag of resources and help the next person. And if you're not willing to be uncomfortable and realize that you need to learn something more, or you could have addressed something better, or that you let somebody try something that maybe you should have thought out more thoroughly, if you're not willing to be uncomfortable with that, then you probably should reconsider whether you want to be a healthcare professional, because once you stop being willing to be uncomfortable and grow as a result of the feedback you get and the people that you meet and the mistakes that they make and the mistakes that you make, you're no longer growing. You should probably seek a different job that deals with inanimate objects, perhaps. But you should rethink it because I'm always being confronted with my limitations. Believe me, and I've been doing this for a little while.
I was actually going to comment about that conversation that we had because when I first started, I didn't know very much about scleroderma, and I didn't think that I had much to offer the patients. So I think that's something that you need to be okay with, that you're learning, and that your patient is aware that you're willing to grow with them. And learn from them, and you can apply things that you learn from patients to other patients. And Dr. Shapiro has taught me that because we certainly, hear things from patients, and then we're like, oh, okay. So then that, might lead to researching something and maybe extrapolating and finding something that really works for a lot of patients. So I think those are things to keep in mind, and definitely the being uncomfortable. It's okay, and you don't want to put on a show for your patient, so I think that's really important in terms of developing rapport and trust. You don't ever, you don't know the answer to their question, you don't make something up, right, exactly, thank you.
I appreciate that more.
Exactly.
I don't know, let me find that out.
Mm-hmm.
Let's work on it together, then, just going to smoke up,
Yeah, exactly. It's okay to not know the answer, and it's okay to, work with the patient to figure out how to solve the problem or come up with the answer. So I think that's something as a new clinician is so, so, so important. And like Celeste was saying, if you want to grow as a clinician, you have to be okay and comfortable, that you don't have all the answers, you don't have all the experience, but it will come. Because I remember that. It was probably the hardest part is, in their first few years as clinicians, not having much experience and just being super uncomfortable, so.
I really don't have much to add because I was lucky enough to have my own 2 minutes, but just sitting here with the group, a couple of things that I think the clinicians are really sharing with you here is to have some curiosity. Be curious about your patient, have a two-way conversation. Don't have expectations of what the answer to the question is going to be, and have your next question in mind without just listening and really opening yourself up to that two-way conversation. We talked a lot about the loss of power that people have, whether it's this diagnosis or any other chronic diagnosis or devastating diagnosis, is that sense of loss of power. And how can you bring power back to your patients? How can you find out what worries them most and work on that piece? And really just be open to what they're going to say to you, elicit their perspective every step of the way, and that really starts with curiosity and a two-way conversation.
I had one little thought. I thought about this earlier in the week, and when I was a very young clinician working in a burn unit, very wise, I think she was probably the unit nurse, they're very scary, by the way, when you first get out there, but they're very smart. You can learn so much from them. And I was 22, and there was a burn patient that was doing very poorly, and she looked me in the eye and she said, when a patient of yours starts to do poorly, you will find yourself wanting to retreat from that person because you interpret that person doing poorly as your personal failure. And if you feel yourself starting to retreat from someone, you check yourself, because that's when they need you the most. And so I would say, irregardless of what population you work with, and I've worked with many different diagnoses, that is absolutely true. There's a tendency to withdraw at precisely the time that they need you most. It also happens with 12-year-old boys. So they're most obnoxious at 12, and you really were like, but that's when they need you the most as a mother. So anyhow, it is a true thing, but you will recognize it in yourself if you're willing to be honest, and don't do it.
Thank you very much. Those were very helpful comments. I found myself writing down some questions that I would add to my list in response to your comments. So I'm curious to see if any of those show up on your lists. Okay, so you have about 10, we ended a little bit early, maybe 15 minutes if you need it. If not, that's fine too. But you have, say, 10 minutes. Go back through your interview. Think about what the panelist said. They gave some very, very, very good suggestions. Would you modify your interviews if you would like to? One request to the scribes, please copy and paste the initial set of questions onto the second form. We want to preserve the first set because we'd like to see what, if anything, changed in response to the panelists' questions. So copy and paste, and then work on that second document. And the panelists will, be able to see what changed.
To be honest, I've never noticed.
I asked the secretary, Kenzie.
It probably did help, maybe help me
He's top. It's a good thing, but like when she went into the hospital back in 2014, she had
supported you throughout the extra doctors coming in, blood work.
they wouldn't try to have an active word. They go, I'm sick.
I'm paralyzed with the set.
So somebody gave me a.
Some of the things we talked about is that he really does start with, how are you? He gets to know you as a person.
She says, there's another option to Mass General. She says, I did that. Hey. Maybe I can help somebody else, Since it's free. That's the key, because I understand what you're saying about finding somebody to push it.
So I'm actually going to ask that our expert panel come down from the expert panel slots, if they don't mind, so that they can offer us some guidance as we go through this interview, and we will let this be our office setting. So I am a really good plan maker and a really good person that changes her plans immediately. So that's what we decided to do. I think that there are two things I want to make sure that I don't forget. Number one is that there was a lot of information on scleroderma at these tables, and volunteers came and set that up for you. Please, please, please feel free to take anything that you would like and ask questions of them prior to leaving today. I know that once we get to the end, we all get anxious to go home, and I understand that, so I wanted to make sure I bring that up now. I don't think we can thank Amy enough for sharing her experience with us. So big applause for Amy before we leave. And the heroic effort that it took for our patients to get here and to be at the table with you. I was lucky enough to be a patient at a table, and it was awesome. So I hope it was a great experience for all of the patients that were here. Thank you so much for being here tonight. Okay, so what I do in my real life is I teach communication skills to healthcare professionals, and one of my favorite formats to do that in is what I call the classroom format, and it's a facilitated interview format. So some of the rules of the facilitated interview format are, this is your safe place, right? The beauty of simulation is, if you make a mistake, it doesn't change anyone's life but your own, right? You can make any mistake you want here, and it's make-believe, so we're okay. It's all right, it's not real. Amy's not really at the doctor tonight. No, she's pretending. So, but she's going to be herself and share her experience. But again, if you make a mistake, it's okay. Do it now. You'll never do it again. Trust. She's only going to make fun of you a little bit. Told you it was a safe place. So what I like to do in these cases is I like to do sort of a time in, time out format, right? So I'm going to ask for a volunteer. So someone needs to be ready. I will wait. I'm going to ask for a volunteer to come up and begin the interview. It was my sense from my table that we had a good sort of initial interview going on. So I would ask that the first volunteer come up and use some of those open-ended questions. Ask a few just sort of initial questions, but then go in and start talking about the questions they would ask from their specialty, right? This is about scleroderma, but it's also maybe even a little more importantly about interprofessional education and what we can learn from one another. And in every healthcare professional is going to ask a different set of questions. So as you come up, I want you to really feel free to sort of transition into your specialties questions. If you're stuck, you can always phone a friend, right? You can always just pause and say, I have no idea where to go next. And we'll help you. I'm going to ask that our expert panel help out in those moments and say, this is where I would go next with this interview. What I'm also going to ask is that it can be very difficult to be the patient and give feedback as you're going through the interview. So Amy and I've talked. She's going to go a little bit into neutral when I'm waiting for the next brave volunteer to come up. All right. Sound good? Who wants to start the interview for me? I feel really bad for my table right now because they developed an excellent rapport with me. I will call on someone, but I hate doing that. Somebody wants to go first. The first one's the easiest. All right, yay, come on up. So when you start an interview, it's important to introduce yourself and your role and find out your patient's name. So you can start by that. You are going to be interviewing Amy as herself. Why don't you, here, I'm going to hand you this because I have a big voice.
I think it's on.
You guys going to share?
Hello. My name is Kimberly, and I am here from a psychology perspective. I'm taking a positive psychology class this semester. One of the most important questions for me, and the first one that came to mind when I started to learn about this, was, and I like the way it was framed by someone on the panel, what keeps you going in terms of resilience?
So go ahead and ask her, like, you are walking into that room, you just said, hi Amy, thanks so much for coming into the office today.
Hi Amy, it's nice to meet you. Thank you for coming in today. I'm wondering what keeps you going? What builds resilience, for you?
For me, I think the thing that keeps me going is obviously my support system, which is my family. My dad's back there. Say hi to my dad.
Hi, Dad.
I embarrass him all the time when I do this. But I think for me, it's them. They keep me going, my family life. And I think anytime I'm feeling down or like kind of having a bad day, my outlet is to write. I'm a blogger. I have an online support group through Tri-State, and I blog. I have about, 20 articles published on an online magazine called The Mighty. So I think that it's important for me to release, or anybody with this disease to kind of release and let go of like the expectations that I don't know, I think you kind of have to you have to let go of your old life. So, and it can be frustrating. So I think just pushing through and trying to set goals for yourself and reach those goals is always an important thing to do. And one of my goals was always to be a published author. So now I am.
Excellent. Another question that I feel is really important, seeing as you're such an advocate, what is the advice that you would give to someone newly diagnosed who is afraid, who is wondering why me, who is in a state of starting to research, and we talked a lot about researching, and it's scary what you find on Google about any disorder that you have. So what is advice that you would give to someone newly diagnosed?
I think the advice I would give is it's okay to be mad, to be upset, to be angry, to kind of not be okay. It's okay to not be okay with it. You're allowed to feel all the kinds of emotions that you want to feel. It's your body, it's your life, and you're allowed to go through it. You're allowed to have days where you don't want to get dressed and you want to stay in your pajamas all day. That's fine, but it's what you choose to do with the next day and the day after that kind of really makes for you as a person. You have to kind of I think you have to try to spin things into a positive light. So I'm allowed to have a bad day. I'm allowed to have a 15-minute pity party for myself in my room, doing whatever I want to do. but then I have to pick those pieces up the next day and take whatever thing that brought me down and bring it in and try to spin that into a positive light. But I think it's okay to feel all the kinds of emotions that you want to feel. And I think it's helpful to go to a friend, a family member, whoever you feel the safest with your emotions and with your thoughts and your fears and the joys of your life, and just talk it out, scream it out, yell, whatever you have to do to get past it. But just realize that it will pass, and you can have a healthy, semi-healthy, productive, livable, full life with scleroderma. It's not a death sentence by any means. There's all different ways of treatment now than there was, back when I was diagnosed. It's not as scary as you might think. Are there scary things about it? Absolutely.
So I'm going to pause us. I'm going to actually pause us. So one of the things that I'm going to reset us a little bit so that we can put Amy a little more in the doctor's office, right? So that you're really doing just an ask and answer type. It's great. I wish all your patients were like Amy and told you how they thought and how they felt. So I think what happens there is you may say, what would be your advice? And she may say that there's all these struggles and say, how do you deal with that? Right, so that you get it back into the room with Amy. Amy, I bet your practitioners struggle because you are so positive, that you're out there being so positive and making such a difference in the world that I think it might be hard to get Amy to actually talk about her current struggles. So Amy, really concentrate on what you have going on.
Okay,
and ask
like a
her,
specific?
Real specific. And ask her some, maybe, right, we've gotten our open-ended questions. We have an idea of Amy because she already shared with us and we did our interview at the table. But I really like what you showed us is I'm going to get right down to your emotional being. And I thought that was great. So just set it up and just to make it more about the two of you and see how that works out. And you can ask one more question or two more questions, and then we're going to get her out of the hot seat, and I'm looking for somebody else.
Can I phone a friend?
She can phone a friend. Does she want to, so where are you looking?
I'm looking for like
want to
a
go next?
specific question. Like a more specific, personal question.
Why don't we get somebody from a different specialty? Who wants to come on up? Come on up. Great. Thank you for being in the hot seat first. So appreciate you. So you're going to introduce yourself, you're going to introduce your role, so that will tell us who you are and what your specialty is, and you're going to ask some questions that are specific to your specialty. And as a group, remember that we're doing this so that we as a group can learn what are the questions that this group would ask versus this group of practitioners. Okay, so we know who to reach out to get the right help.
Hi. I'm Talia. I'm an occupational therapy student.
Okay.
So what is your understanding of occupational therapy? Have you ever received it before?
Why don't you tell me? I have.
What do you know? I want to know what you know about it.
It's more
You're going to have to talk a little bit more into the mic is what they're telling you. You actually have to hold it up to it's like you're on The Voice.
All right.
You got it.
All right, so I want to know what you know so I can maybe fill in the gaps of...
Okay, so what I know is it's more of a day-to-day therapies, like tying your shoes or how you walk, things, assisted things like that. Like whereas physical therapy is more to rehab you from an injury. Is that pretty close?
Awesome. Yeah,
okay.
That's a good answer. So is there anything that occupational therapy has done for you so far?
I haven't had a lot of occupational therapy, but I've had to use like different gadgets and gizmos that I've kind of created on my own at home to kind of help with things that I can't do, like opening jars. We have this handy dandy fancy jar opener at my house, and my dad has put different hardware on all of our cupboards so they're easier to open, instead of like the ones with where you stick your hand through the hole. Like I can't do those. He does the ones where you pull. So we've done that, and then we've done some handicap bars in the bathroom in case I slip and fall for some odd known reason. I'm very klutzy, but I've always been very klutzy even as a child, so we probably should have had those up a long time ago.
sounds like you and your family have done a lot of adapting on your own, even without occupational therapy. So you've listed some specific things you've adapted. Is there anything that maybe you've kind of come to a wall that you still feel needs to be adapted that OT maybe can assist you with that you haven't been able to figure out on your own?
Oh, that's a good one.
What's difficult?
Excellent questions.
Life in general is pretty difficult with scleroderma, I'm not gonna lie. There's a lot of things that you can't do. We have a really big step coming from the outside of our house to the inside that we haven't really been able to master yet. Well, mostly because I don't want like a ramp. So, like I want to be able to walk for as long as I can walk, and it's more my fault because I'm kind of stubborn with assistance. So, but there's that, and then there's always, in the shower, I wear like shower flips because my feet hurt. I have a lot of problems with my feet. So, it's always really slippery when I wear like flip flops in the shower to get out with all the soap. So maybe finding something that would help in that area would work for me. I don't know if that's your expertise either.
No, that's literally exactly it. I'm gonna ask one question about that. And then,
Okay.
So the stair that you're talking about, what exactly is it about the stair that's...
It's too high.
It's too high?
Yeah.
Have you ever thought about like a stepping stool to get onto just that one step?
Yeah, I think with the stool, yeah, I don't know. I think with the stool, the step is high, but there's still a gap, so it's a little hard. And in the winter, it's icy by where the step is, so I don't want to go on the stool and then, whoop, and then the stool slides out. So I mean, maybe putting like stoppers on the stool, that could help.
Look, you just came up with your own.
So what's happened here, right? Yeah, Gadget Central. The first thing she did was she found out what the patient's understanding was of occupational therapy. Right? Then she elicited the patient's perspective. Where is the wall that you've hit? She found out that she's really doing a lot of things on her own. What is the wall that you've hit? And then she was able to offer some advice, right? If she had just gone in and said, I know that patients with scleroderma sometimes have difficulty with handles, and so we're going to give you some new handles. That's already done, right? We have Dad Gizmo in the back who's solved a lot of the problems, but she still has more, right? So you don't want to stop there and say, all right, you're doing great. And you did a really nice job of saying, but tell me what walls you're hitting. And I thought that was great. And you do have some ideas, but she also expressed some fears, right? She elicited her perspective. I'm a little fearful I could fall there. So you might have to think further. You might have to come up with some other ideas. But offering options, I think, to patients is really important. When we were sitting up here, we talked a lot about the lack of power that patients have, and this is a way to give the power back by finding out what might work for them and what might not. You have another question you want to ask, don't you?
I don't have to. We can move.
Go for it. Go for it. I keep pausing you.
I just wanted to know how it's affected any important roles in your life, and maybe what steps you've taken to continue with those roles, kind of back to the resilience.
Okay. I think the roles that has affected the most is my role as a professional, like all of you guys sitting out here. I didn't get the chance to finish college because I was too sick to complete it, so that was a big regret in my life, but I think I've turned it around with my advocacy work and my speaking and my support group online, and I also babysit twice a week to my beautiful godson, who's 19 months, and that's enough work for me.
So that was great. She just gave you a lot of good information. You know she's a blogger, right? And I think we talked a little bit about discomfort, and it can be uncomfortable to say to Amy, I noticed that you have some difficulty with your hands. How does that affect you on a day-to-day basis when you're babysitting your beautiful godson? When you are going to type. You just told me you're a published writer. Wow, that's amazing, right? So don't be afraid to actually bring it up, right? I'm sure, I know when I'm presenting and my hands are turning white, people are like looking at it like, ooh, that's weird. And I just wish sometimes I could just be like, it's nothing. Don't worry about it, I'll be fine. it's there. It's okay to bring it up as the provider, and that might make you feel a little bit uncomfortable, but she's opened up that opportunity by saying what she does for a living. And that's an opportunity. That's where developing rapport is so important, because it leads you to the next thing. So I think you could say there, that's great. I'm looking at your hands and I'm seeing that some of those tasks that you're talking about might be difficult for you. How do you do that? Would you be comfortable with that? Amy?
Yeah.
Sorry, I always say don't ask for feedback.
That's fine. I know, well, there's tons of ways you can type without actually typing. They have the computer systems now.
So just tell her what you do.
I type with a couple fingers that work. It's slow, but it gets the job done. But I know there's like computer systems that you can speak and it types for you. And I looked into getting some of those. And as far as babysitting goes, I come home exhausted and I take like a 10-hour nap. And then I'm good to go. And it's not every day. I kind of stagger it out to every other day so I can recharge.
Hi, Amy. I'm Jamie. I'm a nutritionist, or almost.
Okay.
I guess I just wanted to ask you a little bit about what your day is like from a meal perspective. What do you like to eat? What are your favorite social activities that revolve around food?
Okay. I'm kind of limited to what I can and can't eat because I have a lot of throat issues with the scleroderma and swallowing, and I have a lot of reflux issues. So, but I'm not going to give up. Like, soda is one of my vices. I love it. I'm not going to give it up. I don't care. It's my comfort. I've always been like a comfort eater, so food is my comfort. And to be limited to no caffeine, not a lot of fried food. You can't have steak because it's hard to cut up. There's a lot of restrictions, not a lot of spicy food, not a lot of citrus food. So if I find something I really like, I kind of eat that until I get sick of it. Peanut butter and jelly for a while was something that I ate a lot of until I got sick of it. But
what is it right now?
I like the peanut butter M&Ms. I eat a lot of those until I get sick of it. I'm a big junk food eater, so the nutritionist is not gonna like me. But I try to eat my vegetables and fruits every day.
So that was awesome. Most patients are not going to be that honest. They're going to be like, yeah, I rarely have a soda. It's not like I have one right here right now at my appointment. So she's incredibly honest, right? She's just being incredibly honest. So it's going to be hard for you as a nutritionist, right, to go in and give way too much information on all the good things. So you've just found out from her you're going to have to pick and choose.
Yeah.
Right? You're going to have to pick and choose. What I loved about that next question that she asked, that follow-up question, is, what is it right now?
Mm-hmm.
Right? That was a great question.
That was good.
And peanut M&Ms maybe aren't great. Maybe we could go back to peanut butter and jelly.
That's what I'm eating right now.
But I thought that was a great follow-up question. But this is a patient that she just revealed to you that she has been given a ton of restrictions, and she's not going to follow all of them. I can tell you that Dr. Shapiro would really like me to drink less coffee. And I usually tell him the truth. So, keep that in mind. So where do you go from here with somebody who's admitting that I find these restrictions very difficult for me?
I guess my next question is about support as it relates to food, and I just wanted to know a little bit more about, are you preparing your food? Is someone else helping you? Are you eating out? What is that like as far as preparation?
Okay. I still live at home with my parents, and I have a younger brother that lives there. So for the most part, my dad's retired, so him and I cook. He does most of the cooking, but I help. Right, Dad?
He's nodding.
He does a lot of the cutting up stuff that I can't do. So we tend to eat dinner probably 5-6 times a week at home. So it's prepared by us. And then sometimes we do like a lunch, like soup and salad place. And I'm not really that big of a breakfast eater. I know it's bad. I don't really eat a lot of breakfast. Because milk is not a good thing for me, and bread is hard to swallow and stuff like that, so I just kind of stay away from it unless I have like an egg, which is not that good either. But Yeah, so mostly we do like at-home dinners as a family. My parents have always done that since we were kids, so we try to stick to that.
That's great. Okay, so that's good. It sounds like you have a lot of support, and that's helpful, especially when you have so much else to deal with. You could always try peanut butter in the morning. It sounds like you like peanut butter, so a smoothie with peanut butter in it might be something that you enjoy, and it doesn't require as much eating. It's just kind of having it there and sipping on it. Might take the place of like the caffeine that you miss.
Yeah.
My next question is, you said you make dinner and your dad helps you and things like that. What are the meals you most look forward to that you guys make together?
Probably not healthy ones.
Lay it on me.
Tacos, it's one of my favorite. I guess it's healthy. We do chicken, we do beef. And then my mom, we're Italian, so my mom does homemade sauce. So that's always good, but I can't eat a lot of that with the tomatoes and the acid. So I usually do like plain noodles. It's not as good, but the cheese is good on it, so that's good. And my dad makes a good meatloaf.
Okay.
So mashed potatoes, corn, that kind of stuff.
I too like noodles with cheese.
We all do.
Are there certain foods that make you feel especially good? Are there foods that you eat and you say, wow, I feel good right now?
Yeah, junk food. Yes, junk food. Like I said before, I'm very much a emotional comfort eater. So when I'm feeling down, if I have like a Charleston chew or a Reese's peanut butter cup, it's a little pick me up, even though it's not the right thing. But like, I like apples and peanut butter. I do that. And I like watermelon in the summer if it's really hot. So yeah, I mean, those are healthier.
Yeah. I was just wondering in general. It didn't need to be healthy. Do you like bananas?
I do. I like bananas.
I like bananas and peanut butter. That's why I was asking.
I could try that. I haven't tried that yet.
So I'm gonna applaud you guys, not only because Jeff Brewer's talking my ear, but because we have a good idea. So this is tough, right? You got a patient here who's not a very healthy eater. Sorry, Amy.
That's okay.
So I think it's hard. Where are you gonna go? And so I'm gonna hand this to you. We want to talk a little bit. Go ahead.
So this situation, I think, comes up in clinic an awful lot. So you have a patient who's being honest, and you want to encourage that, right? And so one thing that I like to say in this situation, when she says, I like junk food, and then kind of looks at you and says, what is your response to that, right? So your response is, there's no judgment here.
Okay.
You know, and so, this is your life. I need to know what you're doing, and then together we'll make a plan that you enjoy and is least going to affect the scleroderma. So to be truthful, I don't deal with scleroderma very often, but I think a lot of patients have these concerns, and what they eat does affect their chronic disease states very often. Thank you so much.
So this is our perfect transition to pharmacy because thank you so much, and thank you for your honesty, Amy. So perfect transition to pharmacy, right? Because often, so I need a pharmacy student, and I'll talk while you're walking up. Come on up.
Oh yeah, we got a man.
We're going to have a few questions from our pharmacists because we're running out of time. We want to get a nursing student up as well. But non-compliance in pharmacy is huge, right? A lot of times people don't take their meds. So I think what he said is important to pharmacy, all specialties.
Thank you.
Go.
My name is James, so I heard you needed a man up here. So, unfortunately, you just got stuck with a pharmacy student, though. So, how you doing today?
Good.
Good. Here, you can take the mic, too.
So I'm going to make a suggestion because we're running out of time. Why don't you go
Just dive right in.
Why don't you go right from? So I spoke with your nutritionist. All right, just read your note in your chart from your nutritionist. I understand that a good diet's a little rough on you. How are you doing? Being compliant with her medications. Talk to her about her, swallowing function, her esophageal function, her reflux.
Absolutely. So, have you had any issues at all with your medications? Anything to do with swallowing, or even just receiving the pills? Any insurance issues or medications that you're out of refills or anything?
Okay. Swallowing is an issue, but I haven't had too much problems with pills. It's more of the actual packaging of the pills that is hard to do. So I always ask for like the child not safety caps, so they're easier to put on and take off. And most of my pills are pretty decent size. They're small, or I can cut them in half and then take half at a time. Insurance is a different story. Some things are covered, some things aren't. Some things I take for scleroderma, but it's not necessarily implicated for scleroderma. So I have to get prior authorization, and then that sometimes screws up my refills. And they're real sticklers about the pain medicine. And you have to be like completely out of pills before they'll give you any more. And that's just kind of a hassle, having to go to the pharmacy like 6 different times in a month. So
Definitely. Do you feel that your pharmacist like really understands your condition, that they're understanding that you're not taking these pain medications for like a reason that's something that might not be indicated, but that you really need them for your condition and everything? Like, do you feel like you have a good relationship with your pharmacist?
Yeah. I'm on a first name basis with my pharmacist. He's really great. And they get it. And he has a couple other scleroderma patients in the area that he does medicine for as well. And I'm not on that much pain medicine, so I think they get it, that I'm not like abusing it or anything like that.
Do you feel that there's any like new therapies or anything that you've seen out there on other patients that have been trying, that they've seen success that you haven't really tried yet, or something that you're interested in trying? Or
Yeah, there's obviously the stem cell transplant, which is not a pill.
Definitely.
But it is new success in medicine for scleroderma, and my insurance will not even cover for me to go to the couple places to get the consultations. So it's been hard to do that. And then, I have a lot of heart issues, so a lot of them are not heart-friendly protocols. And it's not for everybody. They tend to want to have people that have had the disease 5 years or less. And a lot of the clinical trials and stuff like that for medications, they want you to have the disease 5 years or less. They want you to be like a brand new scleroderma patient. And I'm not. I've had it for almost 18 years, so there's a little bit of a stigma for that.
Awesome, I hate to time you out.
That's fine.
To continue, I would not have thought of the caps on the medications personally. Don't know how many people from other specialties would not have thought of that, but that was just a key, right? You want to note in her chart. You want to note in her chart that every time she gets that, she could get home, take a look and not have it. So great job. Really nice job of listening for perspective, getting to know her individually. I have to get a nurse up here because they're going to cut me out really soon. Awesome job. Thank you.
Hi, Amy.
Hi.
I'm Olivia.
Hello, Olivia.
I'm a nursing student.
Okay.
So I guess going off the medications.
Okay.
I would not want to know like what medications you're on, including like over-the-counter medications or herbal remedies.
It's a long list. I'll just give you a few.
Okay.
We'll be here all night. I'm not really on any over-the-counter or herbal remedies. I take ranitidine for my reflux in my stomach. I take, for pulmonary fibrosis, I take a Traclear and a Revadio. Right now for the scleroderma, I am on Celsep. And once a month, or once every 8 months, I do an infusion rituximab for my lungs, and it's supposed to help with the skin. And those are just
the basics.
Surface level, yeah.
Okay. So with the medications, I would want to know, do you have any issues taking them? So like, are you having any side effects that make you not want to take them? Are you having any issues adhering to it, just in general, like, oh, I forgot, anything like that?
Not really, because I take so many and I've been on them for so long, there's not really an issue. It's kind of like second nature to me. Mm-hmm. And the only thing that's a little annoying is that most people, if they take medicine, it's 3 times a day. Mine's breakfast, lunch, dinner, bed, so it's 4 times a day. So like when I get admitted to the hospital or something, everything's always 3 times a day, and then I have to go back and tell them, no, 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 I take this at lunch, I take this at dinner. So that causes a little bit of an issue. But other than that, I haven't had any side effects really. I've had a couple, I was on an infusion before the one that I'm on now, and it was really bad. It was making me sick, my hair was falling out, stuff like that. But it was supposed to. It was Cytoxin, so it was supposed to do that. But once I'm on now, everything's pretty good for now.
All right, great. I'm going to time us out because we don't have any more time. Nursing, you just learned a lot, right? One of the things that you picked up right there is, okay, when she's in the hospital, it's a challenge for her because of the typical routine. So if she was an inpatient, that would be a really important question for the nurse to ask and find out about. So I thought that was great. And asking about herbal remedies, over-the-counters, and adherence. And I'm handing off the mic. Thank you, all you volunteers. You were awesome.
We have about 2 minutes. I'm sorry. Thank you, Heather, for a wonderful facilitated group interview. That was really fabulous and very skillful. Any comments from the panelists on what you heard? Any sort of closing remarks? I want to give each table 5 minutes as a group to what did you learn? Give us some feedback. We want to hear what was it you learned, either discipline specific or about scleroderma. In other words, what's the take home from this evening? But before you do that, panelists, anything, any comments, any observations?
I think that a common theme seems to be maximizing quality of life. And also minimizing efforts to do so. So I feel like just trying to minimize things that are complicated and easier to, excuse me, my shoes are too high, easier to implement.
Since this is interdisciplinary, I'd like to just point out that there's multiple facets to occupational therapy intervention, and sometimes it's different in different settings. The adaptive equipment component is one important component, but when it comes to certain types of skilled, specific hand care, that is a whole domain that is very big, and I'm still learning a tremendous amount about it, so it is something that is somewhat unique beyond the very important adaptive equipment.
I think the evening demonstrated also the power of an interdisciplinary approach, and brainstorming is a lot easier when you have multiple brains as opposed to just relying on your own. Also, that we get answers from those that we question, because, for example, I'd like to have a look at those shelves and cabinets and see what your father devised that made it effective. So it was great. Thank you.
I don't think I have much more to offer, but other than keeping in mind, the open-endedness of your questions. So you want to try to ask questions that you get the biggest bang for your buck. So the patient doesn't feel like they're being interrogated. So when you're asking, very broad questions, you're allowing the patient to kind of guide the visit, and that helps to build rapport. So I think that was done tonight, which was really good. So good job, guys.
Okay, now we're going to turn it back to you. If you would be kind enough to give us some feedback on that final form, and also to fill out the post-test, the few questions you filled out in the very beginning, that would be very helpful. We'll take a look at that, and we will send out, I think, as I'm thinking about this, if we can, with Bobby, ask our wonderful interviewees, the people who traveled from as far as Buffalo and Orange County to get here tonight. People, I thank you so much for coming to join us. Thank you very, very much. Yes, you are our best teachers. You're our best teachers, and it's a privilege to work with all of you and to be here tonight. So thank you very, very much. And Don't fill out your forms, and we'll have maybe we'll have a closing, just a closing, and we'll get you out of here at 8:30. Don't forget the people who were interviewed. Please be interviewed again, and but take the next 5 minutes just to give some feedback on what you learned, what stood out, what are you taking away.